I'm Morgan Stone. I'm a family nurse practitioner here at Kentucky Lake Urologic Associates. So I went to UT Martin for my undergraduate, my BSN. I was an RN and graduated from Martin and went to St. Thomas, worked on the chest pain unit there for a year, and then went to Vanderbilt and got my nurse practitioner. And then after that, I've been in family practice for 8 years. I loved treating the whole family from newborn all the way to geriatrics. And some of my favorite cases in family practice had been urology type cases. Kidney stones mainly were the thing that whenever a patient came in with a kidney stone, not for them because they were in pain and miserable, but I liked kidney stones. And so then I've always typically referred patients to Kentucky Lake Urologic Associates in Paris here with Dr. Mobley's legacy, and so then finding out that there was a position available here was just kind of a good thing to follow up on patients that had always loved seeing them and the care that they were provided there or here at Kentucky Lake Urologic Associates, and to move into that now as a provider has just been a really awesome experience. So I've been here a month, and there is a whole new world that I did not even realize in urology, beyond just typical urinary tract infections and prostate cancer and enlarged prostates, those type things. But the surgical side has been wide open on the different things that they provide, and following kidney cysts and masses in the kidneys and removing kidneys that Dr. Mobley and Dr. Betty's do now in surgery for their patients. But in the clinic, following those patients, some are the acute things that they come in and they're short-lived and patients feel so much better, and then unfortunately there's the long-term sequelae of the cancer follow-ups, bladder cancer and prostate cancer and kidney cancer, that those patients you have those relationships with for a long period of time because you're following them multiple times a year and checking their levels and diagnostics. The bedside or in the clinic, in educating patients on, hey, this is what we think is going on, and following them through surgery and then seeing them in surgery, and then just the quality of care that they have and their surgical skill has just been wonderful. And then they're great teachers. They care about their patients. That you're treated like family here, from the girls at the front when you come in and you're greeted with a big smile, and maybe sometimes they treat you better than some of your own family treat you. But just the whole package and following them, and then just that they're excellent surgeons and diagnosticians too. My husband's a fireman in Union City, and then we have 3 kids. Owen's 5, Quinley's 3, and Emmett's 1. So we joke that we work on taming our circus whenever I'm not at work. Before all of them came along, I really enjoyed running, just as a stress reliever and exercise and overall health. I don't get to quite do that as much as I would like to, but I'm starting to get back into that, but mainly just hurting the circus.